नमस्कार स्वागत छ दर्शकवृन्द यहाँहरूलाई कार्यक्रम 24 टकमा म रोहन श्रेष्ठ 24 टकको आजको यस श्रृङ्खलामा हामी नेपालको स्वास्थ्य क्षेत्रमा विगत लामो समयदेखि कार्य गरिरहनु भएका उहाँ डच नागरिक हुनुहुन्छ र युनाइटेड किङडममा बोर्नमन्थ युनिभर्सिटीमा चाहिँ उहाँले प्रोफेसरको रूपमा हुनुहुन्छ उहाँ प्राध्यापक हुनुहुन्छ र उहाँले नेपाललाई विगत 20 वर्षदेखि नजिकबाट निहालिरहनु भएको छ नेपालको सन्दर्भमा अनेकौं अध्ययनहरू गर्नुभएको छ उहाँले र त्यति मात्रै नभएर नेपाली समुदायका विद्यार्थीहरू जो हुनुहुन्छ पीएचडी पर्सु गरिरहनु भएको छ जसले उहाँहरूलाई पनि गाइड गरिरहनु भएको छ सुपरभाइज गरिरहनु भएको छ यस मानेमा उहाँले नजिकबाट नेपालको स्वास्थ्य क्षेत्रलाई बुझ्नु त भएको छ नै आफ्नो रिसर्चको माध्यमबाट विविध क्षेत्रहरू विविध ठाउँहरूको रिसर्चको माध्यमको क्षेत्रबाट योदेखि बाहेक आएर नेपालको शिक्षा क्षेत्रसँग पनि उहाँ चाहिँ निकै नै नजिक हुनुहुन्छ उहाँसँग आज हामी कुराकानी गर्न जाँदैछौँ आज हामीसँग हुनुहुन्छ प्रोफेसर एडविन भ्यान टालिङ्गा उहाँलाई स्वागत गरौँ Professor, welcome to Nepal. Welcome to News 24 Television.
Namaste. Thank you very much for inviting me.
Professor, tell us something about your interest in Nepal, how it, cultivated.
Okay, it started 20 years ago. I was at Aberdeen University in Scotland, and we were advertising for a lecturer in international health. And a number of candidates, and one of those candidates was Padam Simkara, now Professor Padam Simkara. We interviewed him, he got a post, we very quickly became friends. His work was on sexual health, my work was on reproductive health, and he took me to Nepal for the first time 20 years ago. And I always say, if we had employed someone from Mexico or Malawi, I would now be working in Mexico and Malawi. So it was really kind of the person who introduced me to Nepal.
So Padam Simkara is the one, isn't it?
Is the link, yeah.
When you first visited Nepal, when you first came to Nepal?
Oh, that's a really good question. It's a long time ago. But what I remember, the very first time, is the dust and the smell that I just...
20 years ago.
20 years ago. I didn't know what to expect, and Padam didn't know me, so he put me up in a expensive hotel, in Everest Hotel. So I was in a really big, that looked like a colonial hotel at the time, and I felt like a rich visitor, and then rapidly, a couple of days afterwards, he took us to the field to Dachinkali and Chaimale, where where we had the first study on maternity care and women's groups, and tried to get women to come to antenatal care to improve outcomes for maternity care. And this was the first time I'd really been in a developing country, in a poor, really poor area. Before I came to Nepal, the poorest country I'd been to was Turkey. I'd never been to Africa, I'd never been to Asia, so it was really, for me, a really new experience of being in a country that was just so different.
Chaimale was your field of...
The first field project was in Dachinkali in Chaimale, and we worked with women's groups, and what we tried to do is to encourage women to come for existing government services around antenatal care, but also we employed two lovely health promoters to promote aspects of health, to talk about menstruation, to talk all sorts of things that women in these rural areas hadn't talked about. We published a couple of papers about it. One really interesting story, one paper we published in an international journal, and then one of the reviewers from the journal came back and said, "You've been biased because all these women that you've interviewed are illiterate, they're not able to read and write." And so I wrote back at the time and said, if you find one woman in this rural municipality 20 years ago, these were not your average, these were the poorer women in the poorest wards.
In Chaimale itself? Or?
In rural Chaimale, the literacy rate was very low.
Right.
So I think this is one of the major improvements in Nepal that I have seen, that girls going longer to school, girls going to university, the education of the whole population is so much improved. Maybe a bit more than 20 years, 30, 40 years, but it's a real major improvement in Nepal.
Professor, do you want to share something about this visit of yours? What is the main purpose this time you came to Nepal?
Okay. This particular visit is part of a project with a number of universities in the UK, Sheffield, Canterbury, Christchurch, Huddersfield and Bournemouth, and then 2 organizations in Nepal, FACE and Manama Memorial Institute of Health Sciences. And we've been looking for the last 3.5 years about the impact of the political changes related to federalization on the health system in Nepal.
Federalism and the health sector in Nepal, isn't it?
Yeah. The research is nearly finished, and this last week, part of the forum that we organized was to come back with some of our findings and some of the discussions from people at local level, provincial level and federal level to see what kind of possible solutions there are for improvement.
Why are you so much interested about Nepal? To know the health sector, health practices in Nepal, to know the people of Nepal.
Yeah, I think it's a fascinating country. So it's you might not know, you might not feel that, but it is an incredibly friendly country. People are incredibly friendly, helpful. I think it's wonderful to be here, and it has grown. It has grown. I've been here 35 times now over 20 years. So I've been here many times. I've developed friendships, and that's not just with academics. It's also with researchers I've worked with. The local barber I go to. It's kind of it becomes personal. We've had visitors from Nepal coming to stay in our house in the UK. It just once it develops as a personal relationship. And I think Nepal is a wonderful country.
Is it only the reason Nepal is a wonderful country, or there is something that we need to go deep inside to know the root of our society regarding health issues?
Okay, so I think, that's a really difficult, well, not difficult question, it's a complicated question. So I think in Nepal you've got a very friendly, quite tolerant society. So you've got a large majority population Hindu, you've got a minority, but quite large minority Buddhist, and they live together very harmoniously. People are respectful of each other's religions, and I think that is part of that kind of tolerance of maybe being a country between China and India. You as a country you are different, and you have to be. You always have to be aware of your neighbours in political sense, in military sense. So you have, you've learned to work together. I think as a country, but there are not just one. There are many. So it started off with maternity care. I did my own PhD in the UK on comparing maternity care between Scotland and the Netherlands. So maternity care. I'm married to a midwife, so maternity care, midwifery, babies was always part of my interest, and it still is. But very rapidly became aware of the health of migrant workers. If you are an outsider, so if you live in the UK, you know very little about Nepal. You know Himalayas, maybe you know about the Gurkhas. That's probably the most you know as an average British person.
Right.
So I had never thought about Gurkhas as migrant workers, but of course they are. They're migrant workers in the British Army,
Indian Army, in Singapore,
Singapore Army, Hong Kong before that, and then you've got such a high proportion of the population now working abroad that makes it a really difficult issue at one level for politics, because you then become very dependent through your remittances. So governments become dependent on these remittances for income. You then create a different kind of economy, and I think one of the main problems that you have as a country is that lots of good people are going abroad, and then there's no one to do loads of work here. So I read in the paper the other day, Nepal is importing potatoes, onions, and loads of other things, and I think, but you can grow them yourself. The soil is good here, but often there's not people to do the work, or so
they are much frustrated with the political and the social environment of Nepal. Maybe that is the reason that they are flying to abroad.
Oh yes, but I also think, well, it's kind of a collective psyche. So if you get one or two people going abroad, no one would notice. But if everybody goes, then everybody talks about it, and so you will have a cousin, a neighbor who's working abroad. They earn a decent amount of money. They buy a new motorbike. So it's a kind of a demonstration. We call it a demonstration kind of effect that people see that happening, and then before you know it, people forget the opportunities that are here. Loads of people, like when I started here, everybody who wanted to study abroad wanted to do a PhD. That's 20 years ago, and then maybe 10 years ago they started talking about MSCs that become to grow, and now lots of young people are going abroad for undergraduate degrees. Undergraduate degrees, the teaching here is not bad. I've taught at different universities, at different colleges. It's not that different from the UK. So why? So
it is satisfactory, isn't it?
I think it's satisfactory. So why would you want to go abroad? Just because it's far further away, it doesn't necessarily it's better. But people are frustrated. They think there are opportunities abroad that they're not here. I mean, a completely different example, but I read in the paper 2 days ago of one of the Nepali guys who was killed in Russia.
In Russia, right.
He was recruited in the Middle East, and I thought, okay, these recruiters for the Russian army or for the Wagner group, they paid him a lot of money. They hadn't. He had paid a lot of money to a broker to go to Russia, to be killed. And I think that is desperation. Why is this happening?
Professor, you just said that you are here on the research project regarding this federalism and Nepal, isn't it? What is your finding on this?
So key findings that we found in collaboration with people locally was that we need to do more and better training of both health workers and the political people at the village level. Okay, so 5 years ago, 6 years ago, you had the first local elections for 20 years, so you appointed a lot of new people. If you or I get elected as a politician, you need to learn. Was there any
specific area from where you collected the sample?
We've collected it from different provinces all over the country. So it's
7 provinces.
No, not 7 provinces. 3 provinces.
Okay.
But the Terai area, the hill area, and the mountain area. So just to be representative. It's a big study, but we couldn't do all the provinces. It just becomes too expensive. But we had to represent the representative area. So it's a good question, but we covered the relevant
Terai, hill and mountain.
Yes, and then Kathmandu. So we looked at training, improved training and communication between health workers and the local elected politicians, because before federalization, all the decisions were taken in Kathmandu, and now a lot of decisions are taken locally. So you need to get people to work together in locally. Communication then was the other one, and that's communication between.
So that is the positive side.
No, that's the problems. That's
problems. Okay.
So yeah.
That you identified while doing research.
Work is needed, and the other one is to really urgent, I would think, is the legislation. So you had the law, yeah. Right. So you had a change in the constitution. The constitution said we're going to have a federal system, and then when you look at aspects of healthcare, say for example human resources or other aspects, these laws are 20 years old, 30 years old, so they're not related to federalization. So people don't.
Can you please provide some of the example that we need to change the law?
Yeah. So on human resources, so about appointing staff in the health sector. My understanding is that the law is about 20 years old. So the law on human, so it's a decent law, but the law was set for a central federal government. Now you've got the provinces. So if the law hasn't changed, the constitution has changed, but the individual laws hasn't. Who's responsible? And if something goes wrong, can someone say, "Well, it's not my problem because the law has the law says it's kind of the central government." So I think Nepal hasn't introduced enough relevant laws, and it's probably not just in health, but also in education and security. But I don't know much about that. But in terms of health, we need to think about we need laws that are appropriate for the federal system to make it work.
What kind of laws should be implemented?
So in terms of human resources, and I'm not a lawyer, so don't misunderstand me, but if you want to employ people locally, because that's the most appropriate way of getting people to come and to stay, then you need to have the legislation that says that the ward chief or the political person in charge of in the ward or in the palika, they can make a decision, they can sign a contract. Wow. Not that the contract need to be signed by the province or that the contract need to be signed by the federal level. And it's these kind of things. So there are general law. So you've got a constitution, which is kind of the foundation law, and all the other laws sit on top of it. Right. And many of those haven't changed yet. So it's confusing. It's sometimes unclear who's responsible for what. Right.
So beside that, what else? What else that we have to change?
So the communication I talked about,
right. And the law,
and the law, and then the working in between. There need to be a little bit better, probably coordination on procuring, buying medicines. At the moment, there is still a combination of, if you buy medicine for a country, it's cheaper, you know. Right. If you buy 1 million doses of vaccination rather than 10,000. So there is what's called economies of scale. So you want to keep that, but also you want to make sure that in the relevant palikas you get the right medicine. So in the old days, in the federal system, there was a list of medicines and people would send those to the health post. It wouldn't always work, it wouldn't always be there, but they would end up sending malaria drugs to somewhere in the mountains where there will never be malaria. So you want to make sure that the relevant people...
The
proper place. So then the best proper place is that when the people locally can decide what they need. So people in Lumbini know better what they need in their ward.
In their own area, isn't it?
In their own area than someone in Daring, because that's a different area, it's a different population, different type of diseases, different risk factors. So you need to be able to make those decisions locally. But you don't want to not do the buying of those drugs locally. You want to do the buying centrally because that makes it cheaper. So.
And you have to disseminate that according to the need of the locals.
Exactly. So you need to have both. So you need to have that needs coordination.
What was their opinion on this?
Their opinion, I think their opinion was mixed. So what I came back with again, you have to excuse me because I read the transcripts in English.
Right.
That there were federalization has made major improvements at a local level. And one of the local improvements is that now the local people are responsible for the health post. They made sure that the health workers turned up for work. And in the old days, it was much more difficult. Health posts were often closed, or sub-health posts were often closed. So there was now a greater responsibility to local people. So if you're responsible to local people rather than someone far away, you're more likely to do those kind of things. Then the local in the local palikas they started spending money on healthcare because they had the local decisions. Sometimes they spend it on infrastructure, which is nice. It's nice to have a new health post, but that's no good if you don't have the staff or you don't have the drugs. So
manpower, no drugs, no medicine, no treatment plan, no infrastructure. Then what?
But a lovely building. So you need to be careful. So that's what I said when I started. You need to train people to know how to be a politician, a local politician. You know, so rather than to say I'm going to build a road or you know something concrete, something physical. Sometimes it's better to employ staff, but you don't see that in the same way, so you don't see the effects in the same way.
So the foremost thing is we have to invest in human capital.
In human capital,
right?
Yes. Yeah.
It's time to take a short commercial break. We'll be right back after the break. दर्शकहरू हामी एकैछिनको विश्रामपछि पुनः आउनेछौँ. ब्रेकपछि पुनः स्वागत छ. दर्शकहरू आज हामीसँग प्रोफेसर एडविन भ्यान हुनुहुन्छ. उहाँसँग आज हामी नेपालको स्वास्थ्य क्षेत्रको विषयमा कुराकानी गरिरहेका छौँ. उहाँसँग यस अर्थमा कि उहाँले विगत लामो समयदेखि रिप्रोडक्टिभ हेल्थसँग उहाँको स्पेसलाइजेसन भए तापनि नेपालमा उहाँले विगत लामो समयदेखि अझ भन्यो भने 2 दशकदेखि चाहिँ नेपालको स्वास्थ्य क्षेत्रको विषयमा उहाँले अनुसन्धानकर्ताको रूपमा रहेर उहाँले विविध स्वास्थ्यको पनि विविध विषयमा चाहिँ उहाँले अध्ययन गरिरहनु भएको छ। पछिल्लो समय भनेदेखि उहाँ चाहिँ यो फेडरल सिस्टममा मुलुकको गइसके पश्चात फेडरलिजम र नेपालको हेल्थ इस्युको विषयमा अध्ययन गर्नको लागि उहाँ नेपाल आउनुभएको थियो र त्यसैको फाइन्डिङको विषयमा हामीले कुराकानी गऱ्यौँ भनेदेखि बाँकी कुराकानी उहाँसँग गर्नको लागि पुनः एकपटक उहाँलाई स्वागत गरौँ। वेलकम वन्स अगेन प्रोफेसर। Professor, you supervised around 15 PhD projects as well, isn't it? 15 Nepali students,
yes,
you know, PhD students. Do you want to comment something on the education status of Nepal?
Okay. So it's a really good question, but it's not related to the students because I am privileged. When I'm at a British university, at the moment I'm at Bournemouth University. In the past I was at University of Aberdeen. The PhD students are the best students. You know, they're the highest academic level. So, and they're good. Otherwise, there won't be PhD students. I've also been supervising and teaching MSc students from Nepal over the years, and a few undergraduates. I've done a little bit of teaching at different colleges here. I think the education system is quite good at the university education system. There are issues about English. Some of the Nepali English is what do you call it? Less than perfect. But the training for example, in our field, PhD, sorry, not PhD, bachelor students in nursing and public health, what I've done teaching, I'm generally impressed by the level.
It's been almost 2 decades that you have been working in the health sector of Nepal, isn't it? Doing research about different issues in the health sector. You did research on migrant worker as well, the health condition of migrant worker as well. What was your conclusion on that?
Okay, so there's a range of conclusions there. So the real
what kind of? Let's start with the problems.
So that's good. That's a good area. So let's start with the problems. So the problems is related to the work, the kind of work that people do. So 90% of migrant workers from Nepal are male. Many of them are unskilled, poorly educated, doing the jobs that we call dirty and dangerous in other countries. Building the stadiums for the football for Qatar, working in the heat, working in factories in Malaysia. These are all quite risky kind of jobs, dangerous. So that's the first problem. So it's the jobs. And then the second part that I found, we had a number of different PhD students and different kind of projects, is the risk related to their living conditions. So the living conditions are often poor. Their diet is unhealthy. They don't necessarily have access to clean drinking water, although not the whole day. Not necessarily be able to go to the toilet often enough, especially in hot countries. So it's kind of the combination of the work and the living conditions. So that would.
What kind of risk they are facing?
So in physical jobs, it's a risk of all sorts of accidents, and the accidents are often like most accidents, they're stupid. So accidents happen because supervisors in a factory in Malaysia speak Malay rather than English, or they speak poor English, or the Nepali guys, their English is very poor because they are in itself uneducated. So there is that communication kind of risk. The jobs are difficult and dangerous anyway, working with machinery and working outside in the Middle East, building houses, factories and so on. So the risk is inherent to the job. So as an occupation, being a builder is risky. It's risky in the UK, more risky than being an academic, or an interviewer. But additional layers then is that you go to as a Nepali worker to a country where the foreman on the site doesn't speak Nepali, doesn't speak Hindi, might speak Hindi, but you don't speak Hindi, so the communication risk then add to that. And then the living conditions, Living conditions are often poor or very basic, communal sharing of rooms, but quite a few guys, often no air conditioning in hot countries, not necessarily enough clean water for both drinking and washing. So these kind of issues that are related to the living.
These are the problems, isn't it? Is there any positive change?
Is it any positive? Well,
or you don't see any positive changes that?
Well, okay. So I see two positive changes, but they're not related to this. So the positive changes I see partly is because Nepali workers are getting better educated.
In terms of health facilities, in terms of health condition, there is no positive sign.
No, I would say that there are some minor improvements in especially in the Middle East, and especially around the Qatar World Cup. The Qatari government was saying a lot of things, and they were improving. The minor improvements. So okay, it's a double negative. There were no improvements, but they weren't that great. But I think the improvements that we're seeing is slightly different because more Nepali migrant workers are going somewhere else. And if you go to other countries, so Nepali government has something like 87 agreements with different countries. So they're now going to places like Romania, Germany, where the labor laws are much better, where occupational health is better. So Nepali workers is going to slightly better jobs in different countries, so that's an improvement. I would like to say the government of Nepal should try to do something about it, but you've got so little power as a country, as Nepal, to say to the government of Qatar, you need to be nicer and look after our workers. It would be innocent to say that, because if the government of Nepal is too difficult, the Qatari government would just say, you can all go and we'll get workers from Bangladesh or from India or from the Philippines. So the government, the Nepali government has an important role, but also very limited because the power is very limited. So, and I think that is a problem that the country is so dependent on remittances, because if a country like Qatar says, oh, we don't want any more Nepali workers, that's really bad for the Nepali economy. So you're really tight.
What about improving the quality of migrant worker from our side?
Yes, well, that's what I said in the people I see who are going abroad to Europe. They're often slightly better educated, therefore they end up in better jobs. So one of the things that Nepal could think about is to train, for example, nurses. So the government of the Philippines does that. You just train loads of nurses to a good standard, and then they can work in hospitals in the Middle East. They earn more, they had a better living, and it's lower risk than being a housemaid in a family. So if we can improve the education level of the general workforce, in the long run, that will be better for the economy. It'll also be better for Nepal, because you've got skills here.
Professor, do you want to analyze something on the current situation of health issues, the policies, the infrastructure, the human resource of Nepal?
In general, or still related?
In general.
Okay.
Before 20 years and now.
Yeah. Okay, so what do I see? I've seen a growth in hospitals, and I think you probably have too many hospitals, especially in Kathmandu. Too many commercial hospitals, and the problem with that is that you create then a medical kind of idea.
Too many
hospital beds.
Too many hospitals and too many beds, isn't it?
I'm sure. Not across the country, but especially in Kathmandu, you get all these commercial hospitals, and there's loads of them, that creates a need for people to do more tests, because tests bring in money. You do unnecessary interventions, and one example is cesarean sections. So I had a lovely PhD student who just finished, Nepali PhD student, looking at cesarean sections rate, Shulachana Dako Rai, and she looked at cesareans, and cesarean section rates are really high in hospitals in Kathmandu. and high.
So that is not good.
And that is not good. That unnecessary cesarean sections, and this is kind of one of the problems with commercial medicine, with private hospitals, that you come in, if something goes a little bit wrong, you do loads of tests, so that's in itself expensive. The more tests you do, the more likely you find something that's not quite right, because nothing is always is ever quite right. And then you do interventions too early, too quickly. I mean, I've had lots of colleagues, junior colleagues, and either they or their wives, their partners, were pregnant, and I think, yeah, you're going to end up with a cesarean section. And these are healthy, well-educated women, and I think they shouldn't end up with a cesarean section. That should not be necessary.
Maternal health,
that's particularly maternal health, but the problem is that we medicalize, that we think we as a society, we medicalize, and we should be thinking, okay, how can we prevent? How can we do more health promotion? How can we improve the health post, the primary care system, to get people to do a bit more exercise, eat a bit healthier, so that they don't end up with obesity 10 years later. So
what about rural Nepal?
Yeah, rural Nepal is, okay, so rural Nepal is really interesting, because I think rural Nepal has benefited quite a lot from remittances. So a lot of migrant workers were from rural areas.
Right.
So they send money back, and then that money gets spent on better education for their children and on healthcare. I think Nepal always had a really good system, and two really good parts of the system compared to, say, India or Bangladesh is that have a health post in every ward. So even before federalization, there was a health post in every ward with a healthcare worker. And then FCHVs, community health volunteers. I think it's a wonderful system, and it works generally really well in rural areas. So you got people who are local, women who are volunteers, who help the local community with especially maternity care, but also with improving vaccinations and so on, health promotion advice. And I think it's a wonderful system.
Professor, are you satisfied with the development of health facilities in Nepal?
Okay, so okay, if I can split that question in two levels.
Sure.
Okay, on primary healthcare, I think we could do better in terms of the health facilities at a regional, so the referral hospitals and the central hospitals. I think you're doing enough. You probably need a couple of more regional hospitals in certain areas, but that's part of general development. That will happen. I'm not worried about it. But I think you need to do, as a country, more about primary care. It's really, really important.
What does it include?
The FCHVs is a really good system. They need to be supported. You know, you can't have, in a sense, healthcare workers who are really quite professional working as volunteers. You need to pay them. How you do that, if that's a remuneration, or you give them a pension. You know, they're still volunteers, but you promise them a pension after 10 years or 20 years. But a way of kind of engaging those. I think the training for nurses to work in rural areas should be better. Not the training per se, basic training, but once you start working in a rural area, you need updates. You know, you need what we call continuous professional development to improve that kind of training for nurses when there's new drugs coming out, new ways of thinking, new ways of communicating. And that need to be, so the education system that goes with the health system need to improve as well.
Do you want to compare with Bangladesh or India and Nepal or UK or Nepal, the policies that the government adopted and all?
Okay, okay. What would be the? Let's compare with the UK.
Sure,
the UK is so UK's got an interesting system with the National Health Service. So it's got a National Health Service, which is not perfect, by the way. It's a good system. It's not perfect. So what you see in the UK, for example, it's really difficult to get a dentist. Okay, so we don't train enough dentists, we don't pay them enough, so dentists start working as private dentists rather than working for the health services. So one of the things we could learn here is that if you want good staff in government hospitals, you need to pay them a good salary.
Right.
You need to make the job attractive. You need to give them continuous professional education, training. So otherwise you lose your best doctors, your best nurses, either to private hospitals or to a hospital in the Middle East.
At last, any advice to the Nepal government?
Any advice for the Nepal government?
Just a summary of our talk program.
Yeah, so at the top level, health must be a priority. Okay, and I know that it isn't always, because governments always have different kind of priorities. But if you can make sure you get good health for your population, you prevent loads of other problems in the future. That's the top one. And on a more general point is that if you carry on the road on federalization, make sure you make the laws that are necessary to make that federalization process work, because it's still a process, that you make those laws now rather than to wait 5 years, 10 years to do that.
Well, thank you very much, Professor. दर्शकहरू यहाँलाई पनि धेरै धेरै धन्यवाद। हेर्दै रहनुहोला न्युज 24 टेलिभिजन। नमस्कार।